Business Matters, presented by the Guamanian Magazine.
Healthcare spending accounts for about 1/6 of the U.S. economy and continues to be one of our most contentious national issues as Republicans and Democrats in Washington spar over whose healthcare plan can best reform the costly system. Locally, Senator Dennis Rodriguez has introduced a series of measures to address what he says are the root problems facing Guam healthcare. And perhaps the key to his plan is to make health insurance available to more people. He would do this by making employee health insurance mandatory for all businesses and by assessing a 4% fee on premiums.
We're putting a pathway for them to be able to afford it with a combination of the employer, and the government sharing in that cost of funding that individual's health insurance premium.
Rodriguez says as many as 16,000 more people who would otherwise not be able to afford it would become insured under his proposal. And their cost, he says, will be no more than 2% of income.
And it's going to be something affordable. It's going to give that person the dignity to know that they've also been able to contribute to their own health care.
He believes having coverage will encourage people to see doctors about their health issues sooner rather than later, when treatment is typically much more expensive, further helping to lower health care costs. Frank Campillo, who runs the island's largest health insurer, Calvo, says he believes the goals are good.
We support expansion of people being insured. That clearly will help the providers who have to serve individuals that are not insured or do not have insurance. That would help Guam Memorial Hospital. That could possibly also help the new hospital. So from the perspective of expanding the number of people that are insured, we support that very much.
But he disagrees with the 4% fee on premiums.
There are contributions from the employer and contributions from the employee. So we believe that taxing individuals that are paying for premiums is almost like penalizing the individuals that have been good in the community, because whatever charges in taxes are made to health insurance premiums, clearly these have to be passed to the consumer.
But Rodriguez says his plan includes safeguards to discourage insurers from raising premiums.
There's mechanisms you put into place, rate reviews, medical loss ratio provisions that we're looking at, that we're going to be able to institute when this 4% is assessed.
We're not opposed to medical loss ratios either. That was in the Obamacare law. It depends what the percentages of those medical loss ratios are. So it all depends what the amounts are. And one of the things that we would like to do is clearly we want to be participants of the process, and we are going to be dialoguing, of course, with the legislators in this process. And the objective is to expand the pool, no question about it. How we get there is the big question mark.
Rodriguez concedes there will also likely be business opposition to the added costs of providing mandatory health insurance, but he says they need to realize that they're already paying for it. He argues that the entire community has been subsidizing the uninsured.
When the insurance companies raise their rates, when the hospital has to raise their rates, when the public health centers have to raise their rates, it's all because there's a population in our community that we service that don't pay for the services that they receive.
Campillo adds that Senator Rodriguez's plan starts a much-needed dialogue that perhaps should have begun many years ago on an important social and ethical issue, universal health care. He says the challenge will be to find a financial mechanism that will make it fair, equitable, and sustainable to finance and subsidize the less fortunate of a society. For KUAM's Business Matters, I'm Nestor Lecanto.
Business Matters, presented by the Guamanian Magazine.